Week number 10, lecture number 1.
Good morning, everyone.
Hello, friends. So, we are advanced to week number 10. In the first week, I said journey is very short. It's a journey of just 24 weeks. A
12 weeks.
correction,
12
12
weeks.
weeks. And almost we have come to the week number 10. I hope you must all have enjoyed this journey
Of learning
of learning about
palliative.
palliative care. Now, here we are talking about dying and death. The week pertains to care of dying. And I just remember not exactly a shairi, but something you can say, Patang si hai jindagi. Here we are comparing life with a kite. What's the life of a kite? When it goes into the sky and anybody can come, any competitor can cut the thread and kite goes off. Similarly, here also, we are not immortal, we are mortal. We have to die sometimes. But what is important is that we are human beings, we remain in a society. So for rest of us who surround the patient, like children, grandchildren and others, friends and relatives, they are supposed to look after the patient. We should be able to try to heal him. We may not be able to cure the disease as such, but they should remain with him. And therefore this thing is there. पतंग सी है जिंदगी कहाँ तक जाएगी, पतंग सी है जिंदगी कहाँ तक जाएगी, पतंग हो या उम्र, पतंग हो या उम्र, एक न एक दिन कट ही जाएगी. But now let us enjoy. Don't worry about it.
So, Yashwantji, you are a multifaceted personality, being a shire, social worker,
Thank you.
and a palliative care physician as well. So, in this week number 10, we are going to talk about dying. Nobody talks about death or dying, and particularly in medical profession as well. But when you are in palliative care, you will be seeing dying patient of very often because we give them good death, natural death, and death with dignity. So here you will be facing patients who are dying. So it is our moral duty and our duty to find out which are the patients who are dying. So the first lecture is on importance of prognostication in cancer patients. This lecture is a very elaborated lecture given by myself, Dr. Geeta Joshi, but where the prognosis of a disease, prognosis of the condition of the patient is very important. Many a times patient and relatives are anxious to know what is going to happen to them. Not only death or life expectancy, but other things also, like he will tolerate the chemotherapy, which other treatment will be good for him, and all such prognosis related questions comes up, and one has to be prepared how to face that question, how to tell the truth, and how to help patient make decisions about their treatment part of the disease. So this is very interesting and very nice subject we'll be talking about. The next topic is diagnosing the dying, physiology and management for generalists. So when patient is dying in terminal phase, maybe few days to few hours, there will be many body changes you will see, and these body changes depends on which organ is first affected, or he is dying because of problem of which organ in the body, that will be reflected into the sign and symptoms on the patient. So it is, as a clinician, as a nurse, or even as a social worker, you should be able to identify these dying signs and symptoms of a dying person and prepare the your team as well as relative to face the death. This is also very good subject to discuss about and increase your knowledge on the this subject. Another lecture is Facing the Death, How to Help, given by Dr. Piyush Gupta, one of the faculty of this course
And he's the secretary of Cancer Aid Society India, located at Lucknow only, and they are doing superb jobs.
in cancer
Yeah,
awareness
cancer
and
awareness and other
cancer
things.
detection. So, facing death, how to help the patient's relative, family members to face the death, how to prepare them for the death, and what else has been described in this lecture?
Basically, he's just saying that death needs to be discussed. Unlike
Yeah,
what happens, we take it that as if we are not going to die. But we must accept the fact that everybody is going to die. Death will come us to some time. So it is very important to discuss about the death and just see various things. Like I have forgotten the name of that nurse who has written a book, Regrets of Life. She had interviewed so many dying
dying
patients,
patients,
and
yes.
she asked,
That
what is your regret now when you are about to die?
die.
So she had collected and collated those regrets of all those patients and just said that these are the normal regrets. And one of the regret was that they could not enjoy the life the way they wanted. This is what is happening to us.
Many of them said that I wish I would have
I would
spent
have done this more. Yeah.
more time with the family and friends. That
So
was the biggest regret everybody
So
had.
here also basically if somebody is dying and as per our culture, if Yamraja is sending somebody to take away, I mean, so nothing can be done about it. But before that and during that time, we can heal them.
Yeah.
We even our presence over there is quite enough. Smiling face. That is how there are so many other points he has given out. Very nice lecture he has prepared.
Another is subcutaneous injection and infusion. Route is not very popular amongst the medical professionals, but it is must to learn if you are practicing palliative care. And this can be managed even by, not only by doctors but even nurses and volunteers and even caregiver can manage this route at home. And this particular route is used in terminal phase of the disease or when patient is in advanced stage or when patient is dying, and also at all such circumstances a small cannula is inserted below the skin through which you can give drug, you can give IV fluids, and you can improve the pain and symptoms of the patient and make them comfortable. So, very important route to study. You will really enjoy learning a new technique of subcutaneous route injection.
You see, Dr. Geeta Joshi, what I think the generally injections are being given three types of injections. One is in the
Intramuscular.
one in the veins, another in the muscles, and this is where how do
It is,
you call it IV or something? Can you
yeah,
just name them out?
intravenous, that is IV, intramuscular, that is IM, and this is subcutaneous below the dermis and epidermis. These are the two layers of the skin, and
Skin,
so
yeah.
below the layer of the dermis is the subcutaneous, and it is above the muscular layer.
So basically, three IV into the veins, IM that is in the muscles,
Muscles.
and subcutaneous route. It is between two dermis, two layers of the skin. Am I right?
There are so many higher routes also,
Yeah. We don't want
intraosseous
to
and
get into it. No, we
intraventricular
just
and all that.
we want to
But
remain.
these are in practice
Yeah.
which we have talked about. So you will enjoy learning this week 10 syllabus and do your best. Theme of this,
Yeah, yeah. You see, this week pertains to basically about death and dying and talking about it. And we also know that in palliative care, we say our aim is to add days in
into the life
life
and no,
and
to add life into
to
the
add
days
life into days and not
days into
days into life. We don't want to extend the life by putting and giving high tech medical treatment, ICU and what is that? What do you have it?
that. Ventilator.
Ventilator and all those things. So
So,
that is not the thing. But one thing we want to give with social support, family support, that
yes.
patient during the time of death remains healed, is happy.
Yeah.
And therefore we just say the theme of this week is death with dignity.
Death
Death
with
with
dignity.
dignity.
Thank you.
Thank you, friends.